welcome to the Quincy Access Television studios. I'm Mark Crosby. Welcome to For Your Health, a program that, keeps health at the forefront and helps you to stay informed and healthy. Joining me, as in programs past, is Caitlin Kirby. She is a public health nurse for the City of Quincy. Caitlin, welcome back.
Thank you for having me again.
Always a pleasure to have you. We mentioned that this program not only airs in Quincy, but airs across the country. Do want to shout out to Avon Access in Massachusetts here, because they're one of the stations that does air this program. So we thank the Avon community and the staff at Avon Access for, I suppose, picking up this program and running with it.
Yes. And a lot of the information I always do it. Like today, we'll be going from the American Lung Association, and I pull a lot of my resources from the CDC as well. So a lot of this information is very universal across the United States, of course.
And that's why it's probably as popular as it is. And then I'm sure the delivery has something to do with it as well. So today's topic is COPD.
Yes, so we'll be talking about chronic obstructive pulmonary disease. And just before we get started, I do want to thank my coworker, Sophie Sosandi. She is an epidemiologist with the Quincy Health Department, and she did a lot of the research when it came to the COPD topic. So I just wanted to thank her for her effort and hard work.
Very good. We will start with an outline. I think that's a good way to start. That's a good beginning. So we will look at statistics. We will look at the definition of COPD, signs and symptoms, risk factors, types of COPD, treatment, prevention, and resources. So that's what we have ahead of us. And I know that you will go through each with precision and clarity.
Of course, of course.
So let's start with statistics.
So according to the American Lung Association, in 2020, 148,512 people died from COPD, making this the sixth overall leading cause of death in the U.S. And COPD makes breathing difficult for up to 16 million Americans who have this disease, and millions more do suffer from COPD, but they might not have been diagnosed and may not be receiving treatment. In Massachusetts alone, approximately 320,000 people have this condition. So it's very important to know what is COPD and what are signs and symptoms to look out for, including those risk factors, to make sure that if you do experience this, or if a loved one does, that they're seeking the appropriate help.
You said, well, just by those statistics, its popularity, and folks will see advertisements for medication on TV quite often for this condition.
Yeah, so it's very common, and as we get into this presentation, we'll see one of the biggest risk factors is smoking cigarettes, and smoking in general. I know there's a lot of out there today with like the vaping and all of that. So it's very important to know your risk factors and how to prevent COPD, because difficulty breathing is no joke, obviously. So you want to prevent it as best as possible.
Absolutely. So let's, turn now to the definition of COPD.
Yeah, so chronic obstructive pulmonary disease, or nicknamed COPD, a lot easier to say. It refers to a group of diseases that cause airway block or airflow blockage and breathing-related issues. And this includes emphysema and chronic bronchitis, which we will go further into. I do have an image of just how does COPD affect breathing. So in a healthy lung, the bronchioles and the alveolus those open to allow oxygen to flow freely. But if you had COPD, a buildup can happen in these different vessels, which makes the airflow a lot less easy. And I'll get a little bit more into that when we talk about the two different types.
I guess now we will turn to signs and symptoms.
Yeah, so a lot of people don't realize they have COPD until they're very far along, because that's when you would start to really notice these signs and symptoms.
Like, I guess, the shortness of breath.
Yeah, so a lot of people experience shortness of breath, especially during physical activity, wheezing, chest tightness, a chronic cough that may produce mucus or sputum that may be clear, white, yellow, or even a greenish tint. You may have chronic or frequent respiratory infections because you think your lungs aren't as healthy, so they can't maintain and fight off infections as well. You may have a lack of energy, unintended weight loss, which typically does happen in later stages of COPD. You wouldn't really see that at the beginning. And most people do also experience swelling in the ankles, feet, or legs. So a lot of these conditions, of course, there's so many different health diseases out there and conditions that can give you these symptoms. But if you're experiencing any of these, and especially as we get into these risk factors, if those apply to you, I always say follow up with your doctor, because it's best to be sure and to start treatment as soon as possible.
And I know we said this in programs past. It's okay to go onto the internet if it helps you to explain to your physician what you might be feeling, but don't make that the diagnosis and just run with that.
Yes, you never really want to self-diagnose. There's a lot of great information on the internet, of course. I always say go from reputable resources, so whether that's the CDC, your state health department's website, or any, like today, how we're using the American Lung Association. So a lot of those .org websites have a wealth of knowledge, and also resources that if you're experiencing it, you can look at for support groups in your area and all of that. But definitely, if you are reading this and you think it applies to you, call a doctor and please follow up, because then they'll be able to start the appropriate treatment for yourself.
And just going back to the signs and symptoms, I mean, they're quite varied. And an individual may have some of these. I suppose they may have all of these. But that would vary from individual to individual.
Yeah, so you might not, as with every condition we review in these shows, you might not check the box for every single one, but if you have even 3 or 4 of them, and the risk factors seem to apply to you as well, call your doctor and definitely check in.
And I know we're not there yet, but when we get to medications, it makes me think of side effects are listed even if it affects just one person, correct? I mean, you don't have to have a lot of people getting the same side effect for it to be listed as a medication, I suppose, not condition, but medication.
Yes.
What's the word I'm looking for?
Like
Effect.
the adverse effects,
Right.
yes. So they do really try to encompass all, like when they do trials of medications, they try to encompass what is reported. Because even if one person experiences that, another person could experience that. It's not everybody's body is a little different, of course. So it all depends on you yourself. I will say I didn't dive deep into the medication portion for this episode, simply because there's so much out there and it's very individualized. So again, your doctor would be the best person to talk to see what is right for you.
Let's look at risk factors. So what does put one particular person at risk?
Yeah, so one of our biggest risk factors, and it's very universally known, is exposure to tobacco smoke.
Another reason to stop smoking.
Yeah, so it's one of the most significant risk factors, and then so it's long-term cigarette smoking. This also includes pipe smokers, cigar smokers, marijuana smokers. in people that are exposed to large amounts of secondhand smoke. So I think as generations move forward, like I know back in my grandmother's days, everybody smoked cigarettes. And it was very common. There's so much out there now to show how poorly it affects your health. But if you do smoke, and I understand it is your choice if you like that, really be conscious of secondhand smoke. So whether you have children in the home, even animals in the home can be affected by that secondhand smoke. So it's not just your health, it's the health for those around you too.
People with asthma, so this would be a pre-existing condition?
Yeah, so asthma, of course, affects the lungs. It's a chronic inflammatory airway disease. And so later in life, where you already have that trauma to your lungs from the asthma, you can be more prone to COPD, especially if you have these additional risk factors. Like if you have asthma and you smoke cigarettes, your chances increase even higher. There's also occupational exposure to dust and chemicals. So this is like long-term exposure. So people that work in chemical plants and are around chemical fumes, vapors, and dust, these irritants can then be absorbed into your lungs, of course, as you're breathing.
And I'm probably thinking on the same line, if you are applying, let's say, fertilizer to your lawn, anything like that, you should always mask up.
It's always good to do because you never know. Like especially, I don't know the exact brand, but I know years ago there was a lawn brand to kill weeds, and then they found that caused cancer. Like if people were spraying that and inhaling it. So whenever you're using chemicals of any kind, it's always safe to wear a mask just so that way you're not breathing it in. And I will say, like, it's really, when we're talking about this occupational exposure, it's very long term. So if you work in a chemical plant for 15 years, that would be like a long-term exposure. Whereas if I walked in there one day, that's not really, it wouldn't really hurt me as much as it hurts that employee that's there every day for their career.
One of the, I believe, one of the reasons given for my aunt's cancer was that over the years she had used chemicals just to clean, just ordinary chemicals to clean the house, but used them so much that potentially that could have injured her lungs, again, without using a mask.
Yeah, so it's very important to protect yourself. Follow the directions on any, like if you are using cleaning supplies, follow the directions. Like I know, for example, if you're ever using bleach in a bathroom, make sure you're proper ventilation. Put the fan on, open windows, because if you're sitting in there inhaling that, it's definitely not safe, especially if you're doing this once a week for 20 years.
Right, right.
So,
and that kind of leads us to exposure to fumes from burning fuel, too.
Yes. So in the developing world, people exposed to fumes from burning fuel for cooking and heating in poorly ventilated homes have a much higher risk of developing that COPD. And that also gets into fire prevention too. If you're ever using any fumes in your home, make sure you have the proper ventilation. So again, those windows, make sure you're getting your chimneys cleaned. I believe it's annually. We can double check with the fire department on that one, but I believe it's an annual. So you really just want to make aware anything you're inhaling, it is affecting your body, and long-term exposure really adds up.
Genetics, which is a surprise. I didn't realize that COPD can be genetic as well.
Yeah, so it's actually an uncommon genetic disorder. It's the alpha-1, I may pronounce this incorrectly, antitrypsin deficiency that can cause some cases of COPD. Other genetic factors make certain smokers more susceptible to the disease as well. But if you have like a family history of COPD and you're not smokers, this is something you could ask your doctor about looking into, just to see if you did have that disorder.
You had referenced at the beginning of this program types, and there are two main types.
Yes, the two main types. So the first one we have our bronchitis. And this is very common. Like a lot of people, if you get the flu, you may develop bronchitis. And it may be short term, depending on, it also depends on other risk factors. If you have asthma or if you had COPD, this can be more severe. So this bronchitis, it affects the airways in your lungs. It's called the bronchi. And these bronchi become inflamed. So the irritation can cause severe coughing spells that bring up mucus, wheezing, chest pain, and shortness of breath. And chronic bronchitis is a more serious condition that develops over time. So your symptoms may get better or worse, but they will never completely go away. And I'd like to say that these extended periods of inflammation cause sticky mucus to build up in the airways, which lead to long-term breathing difficulties.
Right, because there's a blockage there.
Yes. So that's why I always say, like, if you could be in the early stages of this, even if it's just a chronic cough and you're not too sure why you have that, please go to a doctor, because if you do have this condition, it only worsens until you start doing the proper preventative measures. And I will say it won't go away completely, but if you do start implementing treatment, it will stop the progression of getting worse. So you may still be sick, but you don't want to continue to progress to get worse, because difficulty breathing obviously is very traumatic.
And again, that relative I had mentioned earlier had a cough and didn't really, was addressing it with over-the-counter medication for so many years and not addressing it properly.
Yes.
Not seeing a physician and saying, why do I have this in the first place?
Yeah, so it can be that, and a lot of people do that. It's, oh, the cough I've had, it's fine, I've had this for 5 years.
And I think she said, oh, it's just allergies.
Yes.
But you're not a doctor, so you should definitely get a professional opinion on that.
Yes, yes. And then they can aim you in the right direction of how to stop the progression of this disease. Yeah.
So emphysema.
So the second type is emphysema. So this develops over time and involves the gradual damage of lung tissue, specifically the destruction of the alveolus. So these are teeny air sacs within the lungs. So this gradual damage causes the air sacs to rupture and can create one big air pocket instead of many small air pockets, which is how a healthy lung should be. So the reduction in the lung surface area traps air in the damaged tissue, and it prevents the oxygen from moving throughout the bloodstream. So that affects, this of course affects, if you don't have proper circulation of oxygen in your body, this affects your whole body. So it's very important to make sure you're starting your proper treatment. And additionally, this blockage can cause the lungs to slowly overfill, and it makes breathing increasingly more difficult.
And a lot of times folks will hear about smokers that develop emphysema. That's very common.
Yes, yes. So unfortunately, I don't have the exact numbers, but I was looking when I did this research with Sandy. It was saying that men smokers, I believe, are 26 times more likely to develop COPD rather than their non-smoking counterparts. And for females, if you smoke, you're 22 times more likely to develop the COPD. So that smoking and stopping smoking as soon as possible is very important. You would not reverse your damage, but you can help not worsen your damage.
Right. And you mentioned cigarettes, but you also mentioned vaping.
Yes.
Because anything, I guess, that becomes inhaled ultimately affects the lungs.
Yes, and the vaping is obviously, there's been so many studies because a lot of people had been getting sick. But it's still not as well known as the cigarettes. Obviously, cigarettes have been along a lot longer, so we have tons of case studies to see how badly they affect you. So the vaping, hopefully, I mean, you'll see the damage as time comes because it's a foreign substance going into your body. Your lungs are meant to inhale oxygen. So it can be very harmful. So just make sure you know your risks before you start.
Well said. Let's look now at treatment.
So treatment, I feel like I've mentioned this many times, but there is no cure to COPD, but it can be managed. So number one, quit smoking. This is the most important part of treatment for those who do smoke. You would also want to avoid secondhand smoke and air pollutants at home and work as best as possible. So again, that's that cleaning products, make sure proper ventilation. Ask your doctor about pulmonary rehabilitation and take your medications as prescribed, which you want to do for any condition. If you feel the medication's not right for you and it's not working, talk to your doctor before stopping or changing things, because doctors they know how these things work together and how the body works together. So make sure they're in the loop. And then another thing is to avoid lung infections. A very good way to do this, which we're all very aware of right now, is receiving your vaccines. So whether that's like your flu vaccine annually, your COVID vaccine, and staying up to date with your boosters, the RSV vaccine. So any of these respiratory illnesses, make sure you're getting vaccinated. If you can't be vaccinated, make sure you're properly wearing a mask if you're around anybody who's sick and so forth. And also the use of supplemental oxygen can be very helpful to people with emphysema and bronchitis as well.
We always address this in all of our shows, very important, and that's prevention. So let's talk about not getting this in the first place.
Yeah, so there's no routine screenings for COPD when you go to the doctors, but many people do not know they have it, so until they have very serious symptoms. So if you have risk factors, and again, even if you might just have a cough that's been going on for 6 months. So if that's combined with maybe family history, maybe secondhand exposure to smoke, check in with the doctor. That's always my favorite thing to say here. And then again, that best way to really prevent COPD for a lot of people is to quit smoking. And if you don't smoke, don't start, of course. And you also really want to try to avoid those lung irritants that can contribute to COPD. So those air pollution, chemical fumes, dust, and secondhand smoke. So just be vigilant and be vigilant those around you. If you smoke, definitely don't smoke in your car with your windows up with somebody in the back seat because they're basically smoking that cigarette with you. So just be mindful of those around you, and that's the best way to do it.
Well, and I'm glad you mentioned that because secondhand smoke can affect you as well. So you might not be the one that's actually smoking, but you could be inhaling all those poisons all the same.
Yes, and a lot of times those who are heavy smokers, especially if you're smoking in your home, a lot of your fabrics can absorb these chemicals as the smoke's going into the air. So think of that if you have an infant at home and you're smoking inside and that baby's sitting on the couch, they could also be getting the chemicals from the different fabrics. So just really be mindful, and if you are smoking, try to do it outside. And not around others because you don't want to affect other people's health.
The absorption can be, I guess, quite evident. Often I'm thinking of a car that maybe is a used car. You purchase it and you can smell the smoke. Well, that's because it was absorbed into the fabric.
Yes, it also can be evident. I moved into an apartment, and the individual who lived there before was a big smoker, and even just the soot on the walls, like the yellow of the walls. Um, so you can really visualize how the cigarette smoke can be absorbed into things. So just again, try to be mindful and be courteous to those around you if you are a smoker.
And I suppose if you see the discoloration, think about what it's doing, and you see the discoloration on a wall, let's say, think what it's doing to your lungs.
Yes, yes, it's very damaging. And the American Lung Association, so their website is actually just lung.org. They have, you can look on that website and see endless case studies and people who had been smokers and what they're dealing with now. So that quit line is really advocated to really hopefully stop people from smoking and to stop younger generations from picking it up in the first place.
And I suppose in closing, let's look at available resources.
So so these are available resources for great information, and this is where Sandy had done all of her research from. So we have the mayoclinic.org. So you would just look up COPD right under that. The CDC, again, lung.org. And in Massachusetts, we have the 1-800-QUIT-NOW, which is a helpline to help you stop tobacco and nicotine. So that quit line can be very helpful. If you call, it can show you what's available in your area.
And I know we're getting very specific with the next bit of info that you are going to share, but it's regarding Quincy residents that are looking to quit.
Yeah, so if you are a Quincy resident or you know a loved one who's a Quincy resident who is looking to stop smoking, we are very lucky in the Quincy Health Department. We were able to hire Christine Kosha. She is a tobacco treatment specialist, and she does outreach. She'll do different presentations. I know she's done some. She'll be working with QATV, of course, to provide information out there. But I just wanted to provide her name and her phone number, if we could pull that up, and also her email. So if you are interested in even just receiving information, but she does do counseling as well. So she's just a very good resource, and she can sometimes provide like nicotine patches if necessary. So that's a very good resource in our Quincy community that we're so lucky to have. I think she's been with us for 6 months now.
And if you're watching this program in Avon or beyond, because again, it really is, it is airing throughout the country, I guess you would check with your local Board of Health.
Yeah, so definitely check with that local Board of Health to see what's available in your community.
All right. I want to thank you for joining me today and getting some well-needed information out there to the community.
Of course, thank you so much for having me again.
You're welcome. And I would also like to thank Kai, Raymond, and Daniel. They are interns from Quincy High School. They have been crewing this program. Thanks to you for doing so. And thanks to you at home for watching. And please remember to stay well. We'll see you next time.